Welcome to this CPR tutorial from the University of Toronto Emergency First Responders. Before approaching a patient, make sure you're wearing the proper personal protective equipment, like latex-free gloves. You should only begin CPR if the person is unresponsive and not breathing. Start by checking if the person is responsive using the AVPU scale. If they don't respond to your voice when you say things like, "Do you need help?" try a painful stimulus like a trapezius squeeze. If there's no response, you can say the person is unresponsive. Next, assess their airway, breathing, and circulation. Tilt the head back using a head tilt chin lift to open the airway. Look inside the mouth for anything blocking it. Then check if the person is breathing. Look at the chest for movement, listen for breathing sounds, and feel for air coming out of the mouth or nose. At this point, call 911. Tell them the person's age, sex, what's happening, and exactly where you are. Ask anyone nearby to bring an AED. Start CPR by exposing the person's chest. Place the heel of your hand in the center of the chest, between the nipples, then place your other hand on top and interlock your fingers. Start compressions, pushing hard and fast, at least 5 centimeters deep at a rate of 100 to 120 beats per minute. Songs like Staying Alive or Baby Shark are great for keeping rhythm. If you don't have a CPR mask or aren't trained to give breaths, just continue with chest compressions until help arrives. If you do have a CPR mask and are trained, give 2 breaths after every 30 compressions. Place the mask with the pointed end over the nose and use a CE grip to seal it. That's 2 C's with your thumbs and index fingers pressing down on the mask, and 3 fingers from each hand forming E's along the chin and forehead. Perform a head tilt chin lift, then give 2 breaths, just enough to make the chest rise. Avoid blowing too hard. Once an AED arrives, turn it on and follow the voice prompts. Make sure the chest is dry and clear and place the pads as shown, one on the upper right side of the chest and the other on the lower side. Stop CPR while the AED analyzes the heart rhythm and make sure no one is touching the patient. If a shock is advised, the AED will charge. Then press the flashing shock button once it's safe. If no shock is advised, continue CPR right away. The AED will reanalyze every 2 minutes. Keep going until emergency responders arrive or the patient shows obvious signs of life.
Analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of the patient. Deliver shock now. Press the orange button now. Shock delivered. Start CPR.
Now, let's watch a full uninterrupted demonstration of this entire process. For more information, visit utefr.ca or email director@utefr.ca. Thanks for watching!